has a plan to reverse the trend. He calls it Operation Moonshot. It aims to test up to 10 million people every day by the start of next year at a cost of £100 billion.
Our plan, this moonshot that I'm describing, will require a giant collaborative effort from government, from business, from public health professionals, scientists, logistics experts, and many, many more. Work is underway now, and we will get on at pace until we get there, round the clock.
There was Boris Johnson there. For more on the story, let's cross now to Carlisle in the UK and bring in Dr. John Campbell. He also works as an independent health analyst. He's generated a sizable following on social media due to his reasoned and rational insights into everything coronavirus pandemic. Dr. Campbell, it's good to see you again. Let's look at the numbers here. 10 million tests a day. Now, if you look at the population of the UK, you could test the whole population of Britain in about a week and have most of Sunday off. Is this a sensible idea?
This is an interesting unfolding story, which is part based on fact and part based on fiction. The factual part is the Prime Minister's briefing last night at the regular Downing Street briefing, where he talked about this, saying there was going to be a trial of this new method in Salford in the UK. But then there was a leak occurred earlier on today where the British government was communicating with the Scottish government, and somewhere along the way this story leaked out and was picked up by the British Medical Journal. And they got hold of these ideas that there was going to be 10 million tests a day, that the entire population was going to be tested every week. But it's still based on a sort of intergovernment sort of paper at the moment. So to be kind to the authorities, I think we could describe this as the government thinking aloud, because there's many reasons why this idea really is a complete non-starter. I mean, the costs of it are completely absurd. The practicalities of it really are not there. It's described as emerging technologies. In other words, that's technologies we don't really have yet. It would require a very simple test, like a saliva test, and the government have said the result will be back in 20 to 90 minutes. But then what are you going to do with the results when you get it? Now, the more tests that you have, the more likely it is to be a poor quality test. So there could be lots of false negatives. And that means that people could get a false sense of security. They think they're negative, then they go out and their actual turn out to be positive the next day. Could be spreading the virus all over the place, thinking they're negative. And as well as that, people that are symptomatic would still need to self-isolate as well, even if they tested negative. And then, of course, there can be false positives, 1 or 2% false positives quite easily. Could even be 3% false positives. And even if it's only 1% false positives, that's 660,000 people a week who would have to isolate, who are testing for false positives, and their family. That means about 1.5 million people self-isolating a week just on false positives. And if it's 2%, it could be twice that many. It's a very, very impractical idea.
Yeah, and you say this depends on technology that doesn't exist. We've heard that before from Boris Johnson in reference to Brexit and how to deal with the border between Northern Ireland and the Republic of Ireland. So this is a recurring theme in this government. Let me ask you about the number of people in the UK who are currently being tested. How many are being tested, and how is the contact tracing? How is that going in the country?
The official capacity for testing at the moment is about 350,000 tests per day. They're hoping to ramp that up to about 500,000 tests by next month. In practice, on a good day, we're getting about 200,000 tests. Very often, it's only about 170, 180,000 tests a day. Now, the system that we actually know that works, which is the test and trace system, and we know this works from numerous other countries, South Korea, Taiwan, Thailand, places where we know this works, that's only reaching at the moment 70% of contacts. So when someone has definitely been diagnosed, we're currently only reaching 70% of their contacts. So this is where we really need to improve. If we could improve test and trace, then all those people could isolate. We really need that to be a minimum of 80%, and at the moment it's 70%, so we need to focus on that. But of course, this all depends on compliance. This is only working if the people that are contacted and told they've been in contact with someone who are positive obey the self-isolation rules, and at the moment they're not. And another complication, if this was to be rolled out more widely, would have to have some accreditation system to show that someone had tested negative. And that would presumably mean some sort of electronic communication system, some sort of electronic passport to say that we're negative. And unfortunately, our past history on making apps in this country is not that good. We still don't have an effective app in England, although there is one in Ireland that's working reasonably well.
We know that the government has limited social gatherings now to just 6 people, but infections, new infections, are on the rise. Now, Boris Johnson says that the UK strategy, and I'm quoting here, he says it's world-beating. What's gone wrong here?
I think what's gone wrong really is partly this test and trace system's not working. But what we've seen, and this is just not the UK that's affected here, we've seen this happening in France, even more cases in Spain, that there's been a lot of, I think to some extent, the guard has been let down over summer. There's been quite a bit of socialising. People haven't necessarily been obeying all the rules. Mask wearing's getting fairly good now, but there's been a lot of socialising, especially in younger people, and there's been the spread of the virus in younger people. And another infection driver that's been identified in the UK is one family visiting another family, so home-to-home transmission. Put all these things together and that's giving us an increasing rate. And as well as that, schools are going back now, and this is another source of concern, because we've got new data from the COVID symptom tracker app today that's showing about 33% of children that are infected are actually going to be asymptomatic. So this is another potential great driver of infection. And then, of course, universities are in the process of going back as well, which could be a big driver as well. So there are really significant fears in quite a few places in Europe for a significant second wave. Belgium is a notable exception. Belgium's doing very well at the moment. That they've got quite a few things like shopping alone, restricting the bubble size. All these simple things are the things I think we need to focus on. Let's get the simple things right first. Let's do the common public health measures first that we all know about, and then worry about these high-tech things later.
All right. Dr. John Campbell, as always, Dr. Campbell, it's good talking with you. We appreciate your time and your valuable insights tonight. Thank you.
Thank you.